This video series will cover newborn reflexes seen in the first few months of life. The baby featured in this series is Levi Reynolds, who is 3 weeks old at the time of filming. The first reflex that we're going to demonstrate is called the Tonic neck reflex. Notice that when the baby is placed on his back, he turns his head to the right and makes a fist. This newborn reflex disappears at about 2 months of age. The rooting and sucking reflexes are important for a newborn's survival. The rooting reflex is shown when the newborn's cheek is touched, usually by a bottle nipple or breast nipple, and the infant will move toward the source. The sucking reflex is to allow for the infant to obtain nutrients through a bottle or breast. Here we see the rooting reflex followed by the sucking reflex. Both of these disappear at about 3 to 4 months of age. The blinking reflex protects the eyes and does not disappear. This is demonstrated by softly blowing in the face. The stepping reflex occurs when you place the baby's feet on a flat surface. This reflex disappears at about 3 to 4 months of age and is likely the precursor to walking. The grasping reflex is an involuntary holding reflex that weakens at about 3 months of age and disappears at 1 year. The grasping reflex can be demonstrated by touching the baby's palm. The Moro or startle reflex can be demonstrated by startling the baby with a loud noise or sudden change in movement. The baby will fling his or her arms outward and then pull them back in toward his or her center. The Moro or startle reflex disappears at about 3 to 4 months of age. The Babinski reflex can be demonstrated by stroking the bottom of the baby's foot. The toes will fan out and the baby will twist the foot back in. If the Babinski reflex returns after the 1-year disappearance, this could signify a neurological disorder. The Babinski reflex disappears at about 9 months to 1 year old.